Good evening. Today we're going to have a presentation of bioidentical hormones. We have started doing bioidentical hormones at BNG Aesthetics due to the very popular request, I guess. A lot of people concerned about their health being, and they come in and asking us this anything could be done to improve general health. A lot of people, when we're aging, we're getting fatigued, we're getting tired very easily. We have decreased stamina. We have also some sexual dysfunction. So with bioidentical hormones, we're kind of trying to address all those issues. Male, female will treat both sexes. A lot of times, obviously, people have different concerns, different health problems. But in general, bioidentical hormones addressing four major systems in the body. They're responsible for health of your heart. They increase mental clarity. They help with bone and production of calcium and build up of calcium in the bone, as well as improve sexual function of either female or male patients. When it comes to using hormone replacement therapy, anyone at the age of 45 plus, either it's a male or female, they eventually will need some type of hormone replacement. Most of the time for female it will be estrogens, that's what FDA approved, and for female patients it will be testosterone. If you're concerned about testosterone, for example, for male patients, so you will end up having 156 shots a year. They're usually oil-based injections into the buttocks and done once a week. The same thing for female patients. They will have oral estrogens or in the cream estrogens that they will have to use twice a day, and they're kind of messy. And a lot of people not very compliant with applications of those creams, so they start doing and then come off the treatment. So there's not consistent, sustained release of hormones in bloodstream. When it comes to pellets, when they place under the skin in buttock area or the hip area, outer hip area, they work based on your cardiac output. If you're an active person, if you're constantly exercising, or even if you're walking on a regular basis, you will have sustained release of hormones. Again, depends on your body mass, depends on your activity level. You might have a little bit more hormone release throughout the day hours, and then it kind of slows down as you're resting at night. So when it comes to synthetic hormones, a lot of people, especially female patients, when they get on estrogens, there's a great risk for blood clots. There is also great risk for vaginal bleeding. There's also increased risk for breast cancer as well as urine cancer. They also, in some cases, not all the time, they could create some of the formation of gallstones, or even in patients who ended up being hospitalized for those issues. Unfortunately, those things don't happen with bioidentical hormones. Now, when it comes to male testosterone, low levels of testosterone, most people, male patients, they kind of predisposed to coronary artery disease with low testosterone levels. They're also predisposed to developing Alzheimer's disease as the aging progresses and mental clarity decreases. There is a decreased circulatory enzymes in the brain, and they're creating decreased function of the brain, and as a result, they will produce dementia or even Alzheimer's. Testosterone kind of helps to keep levels of cholesterol within normal limits. It also helps to decrease abdominal fat, which a lot of cases, men after the age of 45 become a lot more obese in mid waist and that is predisposing also them to developing diabetes or insulin resistance, as well as hypertension, and mostly people at that age start to get high cholesterol levels as well. So with bioidentical hormones, we're addressing multiple functions of the body. The reason why they call bioidentical, because they form from natural substances. They derive from yams as well as soy. And the molecule of the estrogen or testosterone is identical to male or female molecule of testosterone or estrogen. How do we know what to inject and how much testosterone or estrogen that particular patient will need? Everything is done based on the blood work. We will do blood work pre-pellets. We will pellet according to the levels. We will continue to check the levels in 4 weeks for male and 6 weeks for female. Now, if the patients for some reason did not get to certain levels, then we will offer them a boost about 4 to 6 weeks down the road after the original pelleting. Then we will continue to monitor their levels, and if they're feeling well, which in a lot of times it happens very quickly, for female patients who are suffering from vaginal dryness or a decreased libido, they actually will start feeling within 3-4 days much better. So most female will need to be repelled in about 3 to 4 weeks. For our male patients, the longevity of testosterone usually lasts anywhere between 5 to 6 weeks. So it takes us back to the original slide where you could see the difference. You would need only to be pelleted 3 times a year versus to have shots or to take pills on a regular basis. People will require, depends on what, again, the blood levels are. If there is some thyroid dysfunction or decreased function, we always like to boost the thyroid function as well. So they might need to take some oral supplements. They might need to take some desiccated thyroid for boosting up the thyroid function. That will be additional to pellets, because we only could put pellets, estrogen pellets or testosterone pellets. We don't use any other substances in the pellet form. Everything will be taken orally. So the next, we will repeat pellet, like I said, in about 4 to 6 months, female versus male patient. You start to feel the pellets actually works they start to work very quickly. Female patients start to feel within 3-4 days, and for testosterone it might take about a couple of weeks. So the procedure of insertion pellets usually takes very few minutes, pretty much. The most uncomfortable part probably will be just anesthetic placed under the skin, pellets inserted in the fat layer under the skin. It takes a few minutes for the insertions. Most people tolerating procedure well. There's maybe a risk for bruising. There's definitely some sensitivity for next couple of days. There may be some swelling, but those symptoms usually go away within 3 to 4 days after insertion. Now, one of our patients was she was here and this afternoon, and she was willing to talk about the way what was her experience with hormonal placement as well as insertion and how she feels. And you could see that within a couple of weeks she started to feel better. Her energy level has increased. She actually have better nights. She sleeps better at night. She reported decrease of the hot flashes within a week after the insertions, and she was very, very pleased with just the results of the procedure and the way she's feeling. And she stated that she will absolutely do it again, and she actually sent a few of her friends who also went through the procedure and start to having some improvement in their symptoms.